All right, so let's talk about obstructive sleep apnea. Now, obstructive sleep apnea is a condition that has some similarity to what we call central sleep apnea, except central sleep apnea doesn't have the obstruction, right? Central sleep apnea is when the brain just kind of forgets to breathe, versus obstructive sleep apnea, there's something actually getting in the way of effective breathing during sleep. So we diagnose this by looking at rates of obstructions during sleep. Right? That makes sense. So you have to have one of these two. So either 5 obstructive apneas or hypopneas, so we lose oxygenation per hour plus symptoms. So those symptoms can include daytime sleepiness, feelings of fatigue, or unrefreshing sleep, or if they have nocturnal breathing disturbances, so gasping, snoring, etc. The second criteria, if they have 15 or more obstructive apneas or hypopneas per hour, regardless of if they are reporting any symptomatology. Again, this is an important rule out that we have for people who present with hypersomnia or excessive daytime sleepiness, because this can absolutely contribute to it. People feel so much better when we treat their obstructive sleep apnea. And some individuals do have both as well. So you can have narcolepsy and obstructive sleep apnea for sure. This also can sometimes contribute to things like restless leg syndrome, and has some challenges when it comes to just risk of health outcomes, negative health outcomes, as you kind of go on in time with it untreated. From a prevalence perspective, approximately 14% of men, 16% of women have obstructive sleep apnea. And you're at a greater risk of developing this when you are over 40, if you're considered overweight, if you have large tonsils, because that can physically obstruct the airway, a large neck circumference. So when they screen for obstructive sleep apnea, they will measure and report out your neck circumference. Any craniofacial abnormalities, and certain types of medical conditions like thyroid problems, Cushing's disease, acromegaly, and low testosterone, those can all increase it as well. And individuals who are primarily back sleepers will also have a higher rate of obstructive sleep apnea. So the signs that we see, there are signs that are like very noticeable, especially speaking to someone's partner if they sleep with someone else. So things like snoring, snorting, choking, gasping, stopping breathing while you're sleeping, right? Those are observable symptoms that someone might notice, when just watching someone sleep, which is kind of creepy, but you know what I mean. But other things that we'll see are those self-reported symptoms of things like fatigue, excessive daytime sleepiness, and unrefreshed sleep. Morning headaches are fairly common too. So people, if they, feel unrefreshed, they have some snoring, and they wake up in the morning with a headache that goes away, that gives us a lot of pause to consider obstructive sleep apnea. We then see some kind of harder to define symptomatology, because there's a lot of overlap with other things, but things like difficulty with memory storage, mood changes, depression, anxiety, irritability. So there's some manifestations from that perspective as well. Now, fortunately, obstructive sleep apnea treatment, pretty darn straightforward. We give them oxygen, right? Excuse me. So basically administering oxygen through positive airway pressure, often with a CPAP machine, will help to reduce symptoms, and people will feel a lot better. Now, it's hard sometimes to get used to a CPAP machine, and there's ones that are a bit less kind of clunky, right? Some of them look like from the Alien movie, like the face huggers a little bit. But they just getting oxygen while you're sleeping, apparently super helpful, right? Super important. If someone has obesity as a risk factor, losing weight can help basically reduce some of that pressure on the neck and the airway, and can reduce some symptoms for people as well. Second line, there are some surgical interventions that can help open up the airway. And if it's more obstructive from like tonsils, things like that, they can remove those as well. So those can sometimes be done to help improve oxygenation during sleep. Stimulants for excessive daytime sleepiness. So we have modafinil is recommended in guidelines as second line, but we also have solriamfetol, which is approved for excessive daytime sleepiness with obstructive sleep apnea as well. This doesn't treat the underlying condition, right? This just treats the symptomatology associated with sleepiness during the day from poor sleep at night. After that, there are options for things like bariatric surgery as well as nasal steroids if, again, some of it is inflammation or obstruction more within the nasal passages. And then recently in the last year, tirzepatide or Zepbound, which is a GLP-1 product, was approved for treatment of obstructive sleep apnea in individuals who have a body mass index over 30. So that can be not just a symptom treatment, but by consequence of weight loss, treating the condition itself. Now, why is it really important? Why do I tell everyone they should get sleep studies if they feel cruddy during the day and snore? It's because sleep apnea increases the risk of dying. So we see greater rates of hypertension, cardiovascular disease, cerebrovascular events, atrial fibrillation in untreated obstructive sleep apnea. In addition, we see higher rates of diabetes and chronic kidney disease. Now, again, part of that is probably because of the predominance of higher BMI obesity in individuals who have sleep apnea, but not everyone with obstructive sleep apnea is obese, right? We also see, because of some of those memory and sleepiness, excessive daytime sleepiness effects of sleep apnea, we see increase in accidents and those kinds of risks as well. So, again, on a personal note, when I was going through diagnosis, I was kind of hoping I had sleep apnea, because it's like, even though it's not fun, it is something that is modifiable in a lot of ways and treatable in a lot of ways. And people will, once they get a good fitting product that administers oxygen appropriately, they feel so much better, right? They feel so much better, and it decreases their morbidity, which is amazing.